COVID-19 has left people with a bunch of new information, but maybe not sure how to process a lot of it. So here today we have Dr. Avish Nagpal, an infectious disease physician at Sanford Health. Thank you so much for joining us. I'm sure these have been very busy days for you.
Thank you for having me on your show.
Okay, can I start? I have a lot of questions. So many of our viewers have so many questions. What's the number one thing you would like the general public just to know about what's going on with the coronavirus pandemic?
Yeah, so I want our community to be reassured that we are ready. We do expect cases of coronavirus to multiply in the next few days as we ramp up our testing and our pending tests come back. So you will see our case count go up locally, but I want to reassure everybody that we have been preparing this for a long time now, and we are ready to take care of you.
That's definitely good information. Makes me feel better, and so many others, that you have been preparing. You do feel like you're ready. You're talking about, and it was just in the news, that Sanford Health is now doing some of the tests at a lab in South Dakota. Can we talk a little bit more specifically about who should be tested? Because I would imagine you have a lot of people who want to be tested, but maybe don't qualify for it at this point.
Yeah, ideally, I would like everybody with any kind of respiratory symptoms to be tested. But we are still struggling a little bit with the volume of testing that we can do. We have improved it quite a bit. 2 weeks ago, we could only do 50 tests, and now we have 3 labs who are doing tests for us, including the state lab and then Quest, who's our commercial partner. And then we were successfully able to bring out our own test too at Sioux Falls. So not only have we increased testing capacity quite a bit, we have also been able to reduce the turnaround time quite a bit. The tests that were taking 5 to 7 days to come back last week now should be back within 24 to 48 hours. And that's thanks to bringing and tested in-house. Excuse me.
Obviously, that's a huge difference and very important, crucial, I would imagine, when we're not sure who has it and the spread. Can you talk a little bit about how contagious this virus is?
Yeah. So before I talk about that, I would like to go back to your previous question and clarify who can be tested at this time. So we will be prioritizing our inpatients who are the sickest and are requiring hospital stay to get them tested first. But anybody who has a respiratory tract infection and has had international or domestic travel recently or has had contact with a confirmed case of COVID, we will be able to test all of those people now.
Okay.
And then coming back to your next question, how infective this virus is. We have to remember this virus is only 4 months old right now, so we are learning new things about it every day. But we have a fair amount of epidemiological data coming out of China, Italy, Seattle, and New York now to suggest that the transmissibility is significantly higher. On an average, one infection will lead to 2 or 3 more infections. So every person forwards it over to 2 or 3 more people. But it's not as simple as that. It also depends on how crowded the place is. So areas like Seattle and New York, the bigger metropolitan areas, which are more crowded, will have obviously more infections because of more people interacting with each other. We have had a head start in the sense that we have had the luxury of seeing this happening in other parts of the world, which has given us some time to prepare and learn from their experiences about how we can handle things better. So we have had some head start in shutting down our schools, sports arenas, businesses. So that should help us mitigate some of the transmission already. So I'm fairly positive that we'll be okay.
Okay, what kind of feedback and reactions are you getting from people, maybe within the hospital, within your medical community, but also, the general public, from patients who still run into you and talk to you and want to know, what your thoughts are on what's happening?
Right. So, everybody's worried, everybody's anxious, and we have to remember that healthcare workers are humans first. even though they are labeled as healthcare workers and they work in the hospitals and clinics. So their anxieties are same as general public's, and there are questions that that are on everybody's mind. How long it's going to take before we return to normal? How many people are going to get sick? What is the risk of me individual or my families individually of getting this infection? What is the risk of complications from this infection? So these are general questions which I've been getting from my friends and my coworkers and my organization. And many of these things cannot be predicted. All I can tell you for sure is that yes, we will have infections here, even in people who probably have not traveled because we think the infection is here, even though we don't have definitive proof because of our number of tests that are pending. We are trying our best to do what is called flatten the curve, which means reduce the number of total infections that we get, or at least spread it out over a period of time so the hospital can provide care to each and every person who needs it, and we don't have to turn anybody away. We have increased our capacity quite a bit. We have partnered with Department of Health and other local entities here. We have prepared a special unit to take care of patients. We have opened up more beds. We have ramped up testing. So I think we are in a better place now, preparation-wise, as we were compared to even 2 weeks ago. So I have reason for good optimism here that we are prepared to take care of everybody.
Well, Dr. Paul, thank you so much for your time. Your calmness and your feelings of being prepared, I think, are exactly what we need right now. So thank you so much for your time, and I'm sure we're going to check in with you again at Sanford Health before this is all over. Thank you for your time.
Thank you.
We'll be right back.